That's why we're here tonight. What is naturopathic medicine? Functional medicine. A lot of people know of functional medicine. And I love this diagram for you guys in here. I know you can probably see it. For you guys out there, following on YouTube, Facebook, and for our podcast, what this is a chart. Starts over here with the underlying cause. Then we have physiological damage. These are the body systems that are affected, and these are the symptoms we experience. And this is a good chart because this really shows the difference between our medicine, naturopathic medicine, functional medicine, and conventional medicine that's just giving drugs to cover up symptoms. Drugs, pharmaceuticals live over here just suppressing our symptoms. That's why we never get better. That's why I never got better after those 7 years. That's why I kept getting worse, because I was just covering up symptoms. I was not addressing the underlying cause and addressing the physiological damage. That's what was being done. And that's what our medicine does. We address the underlying cause. What is causing this pathology? What is causing this disease? What is causing these symptoms? And after a while, if we don't address that underlying cause, we do have physiological damage. Some of those underlying causes are elevated blood sugar, insulin resistance, vitamin D deficiency, deficiency in omega-3 fatty acids, deficiency in CoQ10, structural breakdown of the spine, like I had. That's why essential posture is key, especially with ankylosing spondylitis and other conditions where they have low back pain, neck pain. So we can have structural breakdown of the spine. You can have gluten sensitivity, GI infections, toxins, medications themselves, we know cause physiological damage, and then hormonal imbalances. A lot of people out there struggling with hormonal imbalances, and I'll talk about that more tonight. So if these underlying causes aren't addressed, we get physiological damage in the body at the cellular level, and that's what I love about the naturopathic medicine, the functional medicine that we practice, because it's simply addressing the normal physiology of the body and the biochemistry of the body. And it's putting that, we're normalizing that. We're simply normalizing the physiology and the biochemistry of the body to address this physiological damage, to reverse that at the cellular level. It's fantastic. So physiological damage, we can have stress hormone imbalances. I'm really going to focus on those stress hormones tonight. This, if they're not addressed, can lead to leaky gut. We've talked about that. Leaky gut leading to chronic inflammation and autoimmunity. That leads to more inflammation, impaired detoxification pathways in the liver. I will talk more about that, because once we get that leaky gut, where do you think all those bacteria and their toxins, where are they going? Well, they go into the bloodstream through the portal vein, and they affect the liver, and they affect our phase 1 and phase 2 detoxification pathways. So this leads to impaired detoxification, more oxidative stress, more inflammation, and ultimately will lead to mitochondrial dysfunction. That's important because our mitochondria, that's our source of energy at the cellular level in our bodies. See, I was telling you, with our naturopathic medicine, with our functional medicine, we are just dealing with the normal physiology and biochemistry of the body. And that's why our treatments will work so well, especially when we address something like mitochondrial dysfunction. We're literally affecting the energy production at the cellular level of the body. That's why we get such good results. And mitochondrial dysfunction not only leads to chronic fatigue, but that leads to chronic inflammation, and the whole cycle just keeps feeding on itself. So when we address these things and put them in the balance, again, that's why we get great results. And this, now, we have the underlying causes. If they're not addressed, that leads to physiological damage. If that's not addressed, now we're affecting the different body systems, whether that's the adrenal glands, throwing the whole HPA axis out of balance. We get HPA dysfunction. That's our hypothalamic pituitary adrenal axis. I'm going to show you, talk more about that tonight. That's where these stress hormones are getting out of balance, which affects our digestive tract, it affects our liver, affects our immune system, throws it all out of balance, and then affects organs and glands such as our thyroid, our joints, our brain, and our heart. And then we have symptoms. Finally, and then at the end of this road, we have our symptoms. Fatigue, weight gain, depression, anxiety, digestive problems, constipation, bloating, diarrhea, heartburn, poor sleep, pain, autoimmunity, with a lot of other things, hypothyroid, a lot of different conditions. But you can see again with our medicine, we're not starting at the symptoms. We're not covering up symptoms. We're addressing the underlying cause. We're addressing physiological physiological damage, and then we see the body system start to strengthen and start to get better.